Now, I like always to start with a case. Why? Because it will be more stimulating. So this is a 23 years old non-Kuwaiti male. He came to me after he lost follow-up. He was diagnosed with diabetes, type 2 diabetes, 5 years ago, and then went to the polyclinic. They gave him glucophage, and he lost follow-up of the polyclinic, and then he showed up after 5 years of having diabetes to me. So what will you do? We'll talk about it later. Now, my definition of obesity is a mental disease, in my view. And it is a chronic disease, recurrent and relapsing. Obesity, as everyone has said today, is really an important and serious problem because now, especially it is affecting, as Dr. Ahmed said, the teenagers with type 2 diabetes. I'm talking about type 2 diabetes. And almost every family in Kuwait, there is more or less one with obesity. Now, if there is anything that gives me motivation about diabetes and working in social media and making conferences and these things, is that what mentioned earlier by Dr. Ahmed, the common problem coming with type 2 diabetes in teenagers. So, the most serious thing and really depressing thing is that those people with type 2 diabetes, they have an aggressive type of type 2 diabetes as compared to the adults. And this is a study that came in New England Journal of Medicine. As early as 5 years, they end up with all the complications of diabetes. And that's why it's a serious problem, because somebody who is 15 and after 5 years he ends up with renal impairment, what did he have in his life to do? What's the future he has to do if he is end up, and I've seen it with renal failure after 5 years. Why is it so aggressive? This is not the issue. I don't think it is known well, but I mean, it is, you have to know that it is as compared to those who are adult, the aggressiveness is much more type 2. Even studies say even more aggressive than type 1 diabetes. So for me, it's a motivation and a depression problem, and really I am concerned about the health of our youth, and I think in the future, next 10, 20 years, I think will be a disaster if we don't tackle it well. Now, obesity is actually connected to me, in my view, well to the amount of food you eat due to increased appetite, and to less extent is the food quality. I mean, number one is the amount of food you eat. I want you to focus on this. Look, this is quite thin, and this is obese. And I think with what I will say next is that we create people to be like that, obese, and they might be born as to be as normal weight, but we create them by the things that I will talk now. However, it is really important, ladies and gentlemen, that when you see patients in the clinic to do abdominal circumference, it's like doing blood pressure, it's like doing pulse. Why? Because the abdominal circumference is actually the surrogate for visceral fat. It's not BMI, it is more of abdominal circumference according to most studies. Last one was by Salim Yousef from Canada, who indicated that waist circumference is a much better way to measure obesity. And I think For me, it's a sin if you don't do it, or if myself, for myself, if I don't do it for my all patients, because it's really a kind of sending a message to the patient that this is really important. Now, with having toxic environment, mainly with Western diet, and habitual intake of sweet and fatty snack, there was a study just came out in March. Really a beautiful study from Yale University in collaboration with Germany. And they took normal people, they divided them into two groups. One, they gave them for 8 weeks, high fat, high sugar diet. And then the other is the low fat, low sugar diet. And basically, it is an excellent study that showed that the brain, this has, after 8 weeks of having toxic food, which is mainly the fast food that Dr. Ahmed قاعد يتهاوش أحد ولا شيء جيبوا الشرطة. Okay. Then they gave them, after this 8 weeks of, only twice, جماعة, only twice, they gave them per day for 8 weeks, high density food, which is sugar and fat. And after 8 weeks, believe it or not, they gave them a milkshake. And it showed that it light up all the sugar area, or the, what do you call it, the midbrain frontal area, preference for sugar and fatty food. So in a way, there is a change after 8 weeks of giving them such food into a more, let's say, you change the brain and the brain is now more into having, let's say, high dense food. So by having it available everywhere, and there are some studies even 1 week, if you eat 1 week of sugar and high fat, this will change your brain, and as if the circuits of the brain became more of, let's say, liking the sugar fat content. Okay, so, and believe it or not, everyone is being changed in Kuwait, especially kids, with such food. So it could be an acquired problem rather than it is a genetic, in my view. And it's a complex, obesity is complex, but one of the important things that those who are obese, they have low ghrelin as total or active as compared to controls. And this induces increased amount of food. The people usually eat normal appetite. Those who are overweight, they have increased appetite, and that is secondary to emotional eating, which we all suffer from. So there is kind of normal appetite. Then on top of it, there is what's called hedonic appetite or emotional appetite. So you eat whenever you are hungry or sad or happy. And that's why the greatest phrase, in my view, of the greatest book is in Quran, "O Adam, children of Adam, dress properly whenever you eat. You are at worship, eat and drink, but do not waste. Surely he does not like the wasteful. وَكُلُوا وَاشْرَبُوا وَلَا تُسْرِفُوا إِنَّهُ لَا يُحِبُّ الْمُسْرِفِينَ." So even Allah is telling us, don't change your mind. But in Kuwait, this is from the Lancet, Kuwait passion for food cannot be shaken whether by happiness or sadness. So we are always first in appetite and obesity. I hope we can be first in other things. Now, it's the kids we are having, we are making them into obesity because we create them as addicts, because of allowing them to have such toxic food. And usually they say, well, it is only once a week. And then it came to be only twice a week. And then in Ramadan, they break their fast by fast food. And this is when the mass media encourage such thing, like in the Russian news agency that I read last few weeks, they talk proudly about a Saudi boy who is 8 years old who broke his fast with eating a whole lamb. And السيارة شكلها هوندا ولا ما أدري شنو زين بالسيارة قاعد ياكل. He's eating in the car a whole lamb. And the mass media encouraging this, and they say it is a great restaurant. Now, it is not only the amount of food, ladies and gentlemen, it is the timing of food. A great study from the hospital I came from in Boston did this study, which is really tedious study, but clean and really showing that if you eat late after 10 o'clock, then this will cause reduced leptin, increased ghrelin, decreased basal metabolic rate, increased fat deposition. I don't want to go into such a beautiful study, but this is the result of it. And it was done really carefully, and it showed eating late increased your appetite, increased your hunger, and increase the deposition of fat in the visceral area. And I think, see, yeah, it is here. Ghrelin and sulfur-reported hunger has increased. So a lot of ladies, they say to me, he comes from Diwaniyah and he wants to make him machbous and to eat with him at 2 o'clock in the morning. Now, so obesity to me is a central problem rather than a peripheral problem. So once people store to high fat, as I said, in huge amounts, the answer will be obesity, as I have said, and basically because of brain preference to high density food and increased amount of such food. Whenever you see these ads, they say big combo, big, they always encourage big Coke. Everything is big. So it is toxic environment that created our problem rather than genetics. Now, what are the solutions? There are 4. Dr. Esma talked about the 4th one, but I will talk about a little bit about the 3 things that is important, which is diet, exercise, and drugs. Now, with regard to diet, it is any diet a patient like. I don't really force patients to go into certain diet. It is, except the crash diet, which is drinking water or something like that only. The literature actually is pro-ketogenic diet, and I am biased because I use it, and pro-Middle Eastern diet versus low-calorie diet. Now, there is some term called intermittent fasting, which is basically you stop eating from 6 o'clock until 10 in the morning. This is basically, in my view, wrong, and the studies has shown that it is not any better from low-calorie diet, and as I probably show you, and the diet is important in anti-obesity drugs treatment. There are some people suggest just give them the drug and let them go away. I don't think so. I think you should change the brain mentality about food. Now, this study showed that what I say, what I'm biased about, is low-calorie diet is the best. However, look at that. They all end up about the same. So whatever diet you want to choose, you can choose. But you should use diet before, in conjunction with, probably most of the time, with medicine. This proves my bias toward low-calorie diet. This is New England Journal of Medicine, and it showed that it is superior in weight loss and also superior in reducing triglycerides. The only thing was the total cholesterol, LDL cholesterol, and that's true. It's probably the low-calorie diet is better. Now, about exercise. I had a patient 2 months ago. He's 70 years old. He told me the minute I stopped walking, the afia went away. And although I speak all the time about such things, he hit me in the face, and about this quote. It's short, but to the point. Once you stop walking or exercise, you stop, your health will usually go away gradually. Even 10 minutes of talk can be beneficial and may increase longevity 3 years. But however, Dr. Ossan, it has to be daily. It has to be daily 10 minutes walk and kind of excessive walk. But 10 minutes is not a long of time, but most people are really reluctant. Even at home, I talk to them, let's go to work. Most of them, they don't want. So in order to keep your weight down after you lose weight, exercise is one of the essential factors that you need to continue in order to keep your weight down. Unfortunately, this is most of our kids these days. Before, our parents were saying, sit down, please don't be here. Now we tell them, walk up. Okay, so it's the opposite. Okay, now, medical treatment, history has not been good with medical treatment. Why? Because so many drugs were withdrawn from the market. And the problem is so many people, and including doctors, unfortunately, they say no need for medical therapy because it is not a disease. Even in the polyclinic, they say, no, go on diet and exercise, okay? Now, there's a story I would like to share with you about Reductil, which is sibutramine, okay? And thankfully, we are in the era of safe, in my view, and effective drugs. So what's the story of, let me tell you about sibutramine. Sibutramine was a great drug, and I had a huge success with it that made my reputation. However, one of, I don't want to mention his name, he decided to give it, he convinced Abbott to give it to people who are 70 years. And then there is 1% increase in ischemic heart disease. And they say the drug is bad. You are using it in 70 years old who are hypertensive, diabetes, and like you are giving a car, an old car, a great oil. And when the engine is broken, you say, it's the oil. No, the car is old. So, unfortunately, it was withdrawn from the market for this stupid idea. Now, glucophage is a drug that everyone would like to be with. Everyone would like to have in diabetes, in obesity, and it is really funny that USA, they approved it in the year of 2000. Well, Canada and Kuwait, 40 years or 30 years has been approved because of one case of lactic acidosis. Now, glucophage actually is a modest effect. It is a safe drug, it's a great drug, but it has modest effect on weight loss. And its main effect is on those with insulin resistance. Okay? So keep in mind, if you want a good effect, then choose an insulin resistant patient and come to be after few months, a maximum of 6 kg, which is, I think, an overestimation. Now, orlistat, you know orlistat, right? It's a great laxative, a great expensive laxative. Why? Because it's supposed to be a joke. Because it works peripherally. Since obesity is a central problem, then you need central drugs. This one, in spite of all bad side effects, it doesn't work at all. And I don't know why it's still in the market, because it is really useless, in my view. Now, this is the best talk. When we had this GLP-1 agonist drugs, really, it's for me is a panacea, in my view. It solved a lot of problems. And I want to comment on using liraglutide, which is 3 milligram. I think it is obsolete now. It is now GLP-1 agonist once a week or orally. So what is it? What's GLP-1 agonist? It works actually, basically it started to be on insulin-stimulated pancreas. But then it came to be, it worked on the brain, it decreases, which is the most important, is obesity, increased satiety. Stop working, okay. Okay, and it has multi-effects, not only pituitary vessels and pancreas and liver, and actually it is the only drug that I know that can improve fatty liver for the time being. Now, the GLP-1 agonist, a great effect in my view is that it improves endothelial function, and that's why it might increase longevity and decrease heart problem and kidney problems, and might increase the longevity, because as if you are having, let's say if you are 60 and you use it, it might cause endothelial relaxation, and you might end up, for example, being biologically 55 or less, for example. And this is even in people with diabetes. I'm not sure the slide is showing that, but even here. Diabetes is a difficult disease, even to point to it is difficult, okay? So it improves the endothelial function. And that's basically, when it's improved the endothelial function, means it improves a lot of things in the body. Now, GLP-1 agonist is not only that, it also decreases stress of the kidney especially, and inflammation. I don't want to talk about this. This is for diabetes, okay? But it is in obesity. It also decreases inflammation and oxidative stress, and this will give all the benefits that we see with such drugs. Now, the most common in Kuwait, I don't want to talk about it. There are so many GLP-1 agonists, but there is in government, thanks goodness, this is free for Kuwaitis. I will say it's historicity. They say, if you don't want to know, if you don't know how to try this. And then we have semaglutide, which is once weekly, which is more effective than orally. As you know, I don't know if it is available, but we are not much using it as oral. And then the good news is that it has been approved for teenagers. And in my view, so far, excellent safety profile. They say CA, thyroid, this is nonsense. Nonsense. It is medullary carcinoma, and it is so rare. I saw only 2 cases in my life. Now, semaglutide is very effective, and it can cause weight loss up to 15 to 16 kg. Now, I want to tell you in my clinic, my average loss of weight is 45 per month. Okay? And if I do have results after 68 weeks of 16 kg, I will close my clinic. I don't know why they don't have good numbers. I am supposed to publish such results. Unfortunately, we need some backup from University of Kuwait. Now, as I said, it is also approved in teenagers, and it is effective as well as, and it is really, I think, good breakthrough news for me to use it in teenagers. Now, the last treatment that is really becoming everywhere, it's like novel, okay? It's called Monjaro, or tirzepatide, okay? It comes into 2.5, 5 milligram, 7, 10, and 15. And it is really, as compared, believe it or not, as compared to semaglutide once per week, it is much more effective. And it's up to 20% weight loss in those as compared to semaglutide, which is about 15. Obviously, this is in the 15 milligram dose. Okay, in the 15 milligram. Okay, so if you had head-to-head study and it is superior, then this is the drug. Okay? So all doses, they are effective, but obviously you start with 2.5 for the first 4 weeks, then you increase to 5, and then accordingly, if you need to increase, and up to 15 milligram. And I think one day the surgeons will be off in their offices sitting with this new medications. And it is as good as sleep or better without the postprandial hypoglycemia that we are suffering from the surgeries that our patients are getting. One more thing. This patient, what do you want to do? We did blood test. He was symptomatic, blood pressure 160 over 90. He's 23, huh? He's like somebody who's 70. Acanthosis, BMI, increased, abdominal circumference 110, lab 11, HbA1c, urine. The most important, please do urine for microalbumin, please. For every diabetic patient, I'm seeing it so many times, and this is really, if you miss it, this is really a crime. So please, this is 68. Somebody will say, no, it is only high. A little bit high. No, it is high. It is the beginning of problems. So what will you do? Oh, I thought you want to ask a question. Any volunteers? Anyhow, for the sake of time, I don't know what's the time, but okay, just on time. Anyhow, so this was the biggest concern was this, ladies and gentlemen. He's 5 years into diabetes and he's having microalbuminuria, which later he will be having proteinuria. So, talk to the patient and parents, modified ketogenic diet. I call it triple therapy. I like triple, always triple, in everything, okay? So, modified ketogenic, exercise, and drugs, triple. I started him on glucophage, Jardians, sorry for the, whatever, okay? And GLP-1 agonist. Following him every month. After 3 months, weight loss of 12.5, which is around 4, as I said, at least 4 per month. hemoglobin went down to 7.8, triglycerides normal, LDL reasonable to me, okay? And urine for microalbumin is 12, within normal range. Okay? So, this is for me is a big news. We cured his kidney. However, this is a highly, this is a very important slide, the most important slide. Is this rate of relapse very high? Once you stop the treatment, all of them will relapse. Right? And there's a schizophrenic attitude of doctors. When you taste diabetes, you can give it life. When you say hypertension, for life. But for obesity, no, you cannot have it for life, you have to stop it. So if you are studying well for the first course, you will get an A. If you stop studying, you will get an F. The same thing. If you stop the medicine, the weight will go back. Right? Almost only 10-20% will keep the weight down. Okay? So in my view is that once you reach the goal of weight you want, then keep him on maintenance dose, which is once per month, for example, instead of once per week, so that he doesn't have to go to surgery. Okay? So surgery one day, it's like peptic ulcer disease. One day they will do surgery, then now things will be going next year, and then nobody is doing peptic ulcer. The same will happen for obesity one day. In conclusion, obesity is a mental chronic disease. Anti-obesity drugs